Ready?
Yep.
Okay, my name is Caitlin Scott, and I'm going to do a health assessment on a volunteer. All right, first I'm going to look at both his upper and his lower extremities. I'm looking for temperature, which is warm. The skin is moist. The skin is smooth to the touch. I'm noticing hair distribution bilateral equally. No edema notice. Turgor on both is instant recoil. And no varicosities notice and no edema, like I said. Next I'm going to look at his fingernails. They are a normal contour, smooth, pink. Cap refill is less than 2 seconds. And they are well adhered also. Now I'm going to look at his face and scalp and head. His head is normocephalic, face is symmetric. Head is also symmetric. I'm not noticing any lesions or any masses on his head or his face. Hair is smooth, well hydrated, and thick. And now we're going to test for dull or sharp on the face. Please tell me what you feel.
Dull. Dull. Sharp. Sharp. Dull. Dull.
Good. And so his facial his sensory is normal.
Should I close my eyes for that?
Yeah, but I thought you were videotaping.
Just do it like you normally would.
Okay.
Don't worry about me videotaping. I don't even have to get you in the shot. That's
Okay.
not the point of taping.
Okay, sounds good.
All right.
All right, now I'm going to feel his TMJ. Please open and close your mouth. Good. No crepitus or clicking noted. Please move your jaw side to side. Good, and clench your teeth. Good. Now smile and frown. And please stick your tongue out. Good. And what I noticed earlier that when he was talking, that his voice was clear, there was no nasal sounding or hoarseness. I would also test gag reflex, which would, we'd touch the back of his mouth to see if he would gag. And good, okay, for face. Also press against my hand, and press against my hand. Good. All right. Now we are going to move on to, I'm also going to test the sinuses. No pressure noted. And no tenderness or any masses noted. So now we will do the eyes. You check a Snellen eye chart where the patient would stand 20 feet from the chart, and normal would be 20-20, and they would read the lowest line possible. Then I would also check the Romberg test, which is looks at near vision, and that's where a card is held 14 centimeters from the patient's face. And please tell me when you can see my fingers.
Mm-hmm.
Peripheral vision is normal. Please follow my finger with your eyes. Good. Normal ocular motion, nice and smooth, no nystagmus noticed. I'm going to do the uncover test. Just look straight back at the wall behind me. No extraocular movement noted. Please look at the wall behind me again. And I'm noticing that the light in his eye is symmetric. Now, as far as the eye exam goes, his eyebrows are and eyelashes are equally distributed on his face. They're symmetric. The palpebral fissure, both his eyes are symmetric. No lid lag noted. The cornea is clear. The sclera is white. Conjunctiva is pink. Iris is blue. Pupils are equal and round. Please look at the wall behind me. And pupils are reactive to light, both consensual and when the light is shining in the other eye, they're also reactive as well. Follow the pen. convergence is normal, please look at the pen and then look at the wall behind me and then look at the pen again. Pupils can, I gotta hold that close to your face. Try again. Pupils constrict with near vision. The pupils are normally about 4 millimeters and they're constricting down to 2 millimeters, which is perfectly normal. Now I'm going to look into the eye. Please hold your head still. Red reflex is good. Good. The cornea is clear, no opacities noticed. The optic lens is a orangish pink color, which is normal. The AV ratio looks normal. The arteries and the veins are a red to a dark red, which is normal. They're all normally placed. The retina is a normal color, and I'm not noticing any hemorrhaging. The optic disc also is symmetric and looks a good shape. The fovea and the macula are of normal roundness, and the physiologic disc also is a normal shape. All right, now we're going to move on to your ears. So I'm looking at the outer ear, and that everything is smooth, normal color, no lesions noted, and looking inside the ear. Good. The ear canal is a pink color, no excessive drainage noted. The tympanic membrane is clear. There is no redness anywhere. The inner ear, all the aspects of the inner ear look good, and I'm seeing a good cone of light. Okay, I'm going to test your hearing. Please tell me what I say. U2, 3.
U2, 3. MI2.
Excellent. Hearing test is good. We're now going to do the Weber test. Please tell me where you hear, if you hear this in both ears.
Both ears.
Good. That test is normal. Now I'm going to test the Rhine test. Please tell me when you no longer hear it.
Now.
And now tell me when you no longer hear it.
Now.
Good. AC is greater than BC, which is normal. Now we're going to move on to the nose, which is symmetric and straight on his face as would be expected. No lesions noted. I'm going to look inside the nose. Good. That is all. The terminis is clear. The septum is not deviated. I don't see any extra drainage. Could you please plug one nose and breathe in? And plug the other side and breathe in? Good. Airway is patent on both sides. Now I'm going to close your eyes and smell this. What do you smell?
Soap.
Good. So the olfactory is, the cranial nerve is intact. Now what we're going to do is the mouth. So I'm going to grab some gloves, and the lips are pink and moist. And I'm going to assess within the mouth. Could say, good. And the buccal is pink. The gums are pink. The teeth are white. There are no obvious caries. Can you please go like this? The ducts look good. All of the ducts look good. No strange drainage. The frenulum is straight in midline and pink. The sublingual area is pink. Can you please go ah?
Ah.
And oh, I should probably use this. And say ah again.
Ah.
Okay. And the uvula is straight in midline, and the palate is pink as well as the uvula is pink, and they both rise symmetrically. Could you please stick out your tongue? Tongue is pink and moist and midline and symmetric. Okay, now we're going to move on to the neck. I'm going to first feel back here for any tenderness or any masses. Good, none noted. Can you please shrug against me? Excellent, good strength. And press against me. And press against me. Good, good strength throughout. We're going to, let's see, range of motion, go like this, and back, and like this, and like this. And then look over each shoulder for me. Excellent, full range of motion noted. I'm going to look I'm going to feel for any lymph nodes. And into the deep cervical chain as well. And then occipital lymph nodes as well. Good, all that feels good. Now I'm going to feel for the trachea, which is midline, no deviations noted. I'm going to feel for the carotid, which is good, 2+, which is normal, and regular. I'm now going to listen for any bruits, both in the carotid and in the thyroid. Good. No bruits noted. I'm going to palpate the thyroid. Can you swallow for me? Movement of the thyroid is midline, no nodules noted. Now I'm going to move on to thoracic. And for that I'm going to assess both back and front for any lesions, any bruising, any rashes, any masses, any areas of tenderness. I'm noticing this contour of his chest is normal. Respirations are normal. He's breathing easily. And I would palpate both back and front, also trying to feel for any masses or any abnormalities. Now I'm going to, can you please take a nice deep breath? One more time. Good. Chest expansion is normal bilaterally and symmetric. Can you please say, now I'm going to check for infirmities. Can you please say 99?
99, 99, 99, 99, 99, 99, 99, 99.
Good. Fremitus is felt normally throughout. I'm now going to percuss. And percussion is heard normally throughout, and bilaterally it's normal as well. I'm now going to auscultate both the anterior and posterior. Deep breath. Good. 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 Good, and now I'm going to listen to the front as well. Big breath. Good. 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 No extra lung sounds heard, no wheezes, bronchi, or rales. All right, now I'm going to percuss for the span of the diaphragm. Could you please take a deep breath in and hold it, or excuse me, take a deep breath in and then blow it all the way out. All right, and I would mark that spot. You can breathe normal. And then now I'm going to have you take a deep breath in and hold it in. Good. So then I'm going to measure that spot, and that would be the span of the diaphragm. Thank you. All right, now I'm going to listen. Now we're going to move on to the heart. I am first going to listen to the aortic, pulmonic, herbs, tricuspid, and atrium. Good. I'm hearing S1 and S2. I'm not hearing any extra lungs or extra, heart sounds at all. Now, can I please have you lay back? And I'm going to feel for the PMI, which is normal and regular, and no murmurs felt. You can scoot down if your head's hanging off. Great. And now I'm going to feel for pulses. I'm going to feel temporal, radial, and brachial. And can you bend your knee for me? And relax it down. Popliteal, tibial, and pedal. Good. All are around 2+, and I would also check that bilaterally as well. Okay, I think your heart is good. We're now going to move on to abdomen. First, I'm going to observe the abdomen for any striae, none noted, varicosities, any abnormal pulsations. Oh, and also for the chest, I was also looking for any heaves, thrusts, which I did not see any. I'm looking at his umbilicus for symmetry, roundness, and no herniations noted at all. Now I'm going to listen to the bowel sounds, as well as I'm going to listen over arteries for any bruits, and I would listen over any organs for any rubs. And last, the femoral artery. Excellent. I'm now going to percuss the span. I'm going to percuss the abdomen. Good. Percussion sounds good throughout. I'm going to percuss for the span of the liver. And we'll mark it there. Good. And then that will be the span, the liver span. I'm going to percuss for the spleen. And I'm hearing tympani throughout. That we might not necessarily be able to percuss the spleen, and that would be normal. Another way to do it would be to have him roll onto his side as well, and percussing that way. I'm now going to palpate for the liver. And the borders of the liver are smooth. I'm going to percuss for the spleen. And the spleen is not felt, but that would be normal. For kidneys, kidneys are not felt, but that would also be normal. And all over palpation, no masses were felt. All right, now we'll have you sit up, please. And we're going to test the musculoskeletal system. First, starting with the neck, range of motion. Can you go down, back, this way, over each shoulder? Excellent. Now press against me, press against me, press against me, and press against me. Good full range of motion and also good strength. Now I'm going to look at the shoulder, and before I test any more of the joints, I'm going to go through and feel and palpate all the muscles and joints of the body too. I'm looking for symmetry, I'm looking for alignment, and I would look at each individual finger as well. I would assess hips, ankles, and then all the way through all the way to the toes. Okay, now for shoulder, we're going to test range of motion. Please hold your arm out in front and then behind you. Good. And then out to the side, and then up here, and then back here. Good. So full range of motion in the shoulder. Now if you can give me your arm, please. Can you press against me and press against me? Good. Good strength noted. And then hold your arm out straight and press against me. Good. Good strength noted throughout. Now we're going to move on to the elbow. Please go like this. Good. And then the test for strength in the elbow is also for the biceps and triceps like we did for the shoulder, so no need to repeat. I'm going to look at the wrist and the fingers now. Can you go like this and down and then side and side? Good. And then if you can go like this. Good. And then we're going to move all your fingers and bend your fingers. Good. Excellent. Now for the wrist, can you hold your, press against me with your wrist down and then try to press against me with your wrist up, and hold your fingers apart and don't let me put them together, and put your fingers together and don't let me pull apart. Good. And then now can you please squeeze my fingers? Good. Good strength noted throughout. Now for the hip. First I'll have you go backwards, I think. If you want to stand up and put your leg back. Good. And then you can lay down. And then put your hip up, put your leg up in the sky. And then put your knee down to your chest, please. And then rotate your leg out this way. Good. And then internal rotation this way. Good. And then put your leg up straight and rotate it out. And rotate it out towards me. Okay, and while we're laying there, I'll have you test, we'll test strength. So push against my hand this way. And fold your bend your knees, please. And put them on the table. And then press against me and press against me. Great. Okay. And then we'll have you sit up, please. And then can you cross and uncross your legs? Yeah, and then go like that. Perfect. Okay. Now what we're going to do is we're going to test your knee. So if you could please go like that. Good. And then press against me and press against me. Good. And now for your ankle, could you go like this and go like this and like that and like that, and then go in a big circle for me. Good. And then I'm going to have you press against me this way. Good. And press against me this way. Good. Full range of motion and good strength throughout for your ankle. Okay, now we're going to do a neuro test. Could you please stand up? And can you walk heel to toe?
I've been drinking.
He's a little wobbly. Well, you might need an extensive neuro exam. Okay, good. Now you can come back normally, and then I would like you to please,
You need to get into it. Get into a rhythm. When I first started, I'm bad.
okay, then what we need you to do is please close your eyes and hold out your arms in front of you. Good. I see minimal wobbling with his eyes closed. Okay, now you can sit back down. We're going to test your speed and motion, so please go like this as fast as you can. Good. Now, please, here's my hand. Now tap as fast as you can with your feet. Sorry. Okay, good. Now I'm going to hold my finger out, and you're going to touch my finger with your finger, then your nose, and then my finger again. Good. Now I'm going to, can I please see your hand? Please close your eyes. Tell me what number I'm drawing in your hand.
3.
Great. And I'm going to place an object in your hand with your eyes closed. What is it?
Paperclip.
Perfect.
Used condom.
Now we're going to test sharp pain or a light touch in different areas. So please close your eyes. Tell me if it's a sharp in the pain or light touch.
Sharp. Light touch. Sharp. Light touch. Light touch. Sharp.
Great. Now we're going to test vibrations in extremities. So let me see your finger and tell me when and close your eyes. Tell me when the vibration stops.
There.
And then I'm going to do your toe. Tell me when the vibration stops.
There.
You can feel your toe?
No, not really. You got my sneaker on.
Okay. Good. Now I'm going to hold on to your toe, and please close your eyes and tell me if I'm putting your toe up or down.
Up. Down.
Good. That's all normal. Now we're going to please test reflexes. So please be nice and loose for me. Good. Reflex noted. Good. Reflex noted. Good. 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 Reflex noted throughout. Okay. Did I forget anything? Reflexes. I think I got it all. What did I forget?
Your spine.
Oh, I forgot spine again. Oh, good. Look, good. That's only 1 point for that whole thing. Okay, stand up. And then backwards. And then this way. And this way. And then this way. And this way. Good. And then I'm going to stand behind you, and can you please bend forward and then slowly stand up. Good. And I'm checking for scoliosis. That's it then, I think, right? What else did I forget? I'm sure I forget something every time. Remember umbilicus this time. I got light touch, and pain, position sense, vibration sense, alternating movements, finger to nose. Did all that, did all that. I got all those. Yeah, I forgot spine. Did your sinuses? I almost forgot your sinuses. Oh, I forgot. Raise your eyebrows, and then close your eyes, and then try to open your eyes, or don't let me open your eyes. I forgot to do that. Oh, I also forgot. Now I'm palpating your lacrimal gland. Forgot both those. See, I feel like I'm gonna forget something. Like it's just so hard to remember everything, right? So I went over this 1,000 times. Swallowing and gathering. Yeah, that's what I forgot. Glands.
That's it?
Yeah.
That's not bad. Just spine and what you did?
Yeah.
That's good.
That's the last one I forgot last time. I felt more comfortable this time. Glands. I figured that was a lot when I'm thinking about it. I figured umbilicus a lot, but I got that this time. Then spine, I have to remember.
How long does it have to be?
And not less than an hour.
Less than an hour.
Yeah.
Oh. I thought you said it had to be an hour.
Mm-mm.
Oh, good. Because you went 32 minutes.
Oh, well then that's fine.